Stepping in with us now is Carl Shallowhorn from Mental Health Advocates of Western New York. Of course, we've been talking about how you were going to be on our show to be able to, I guess, guide us through.
Yeah.
Any advice for our folks out there, for us ourselves? Because
Yeah.
we're all, like I said earlier in the show, we're in this together, suffering together. And being able to have some sort of guidance through this is very helpful. So thank you first for being
Yes.
with us.
Thanks. Unfortunately, under these circumstances. And I think one thing I want to say is kind of goes along with what Reverend Pridgen said as far as the coming together and mutual support. And I know from my own personal experience as well as the professional experience I've had with counseling and so forth, that people rely on each other, lean on each other, and talk to each other and more or less make those connections to help us get through these difficult times.
Yeah, and there's no shame in reaching out for help, because what we visually saw, a lot of us are going to deal with that for a while. Can you tell people and just express to them that there is no shame in reaching out?
I've been saying this, and certainly most other behavioral health professionals say the same thing. There is no shame in seeking help. There are plenty of agencies and individuals, providers, support groups that do these kind of things that, frankly, it's available if you want it. There's a program I go to that says a closed mouth doesn't get fed. And I love that saying because basically, if you want the help, you have to open up and seek it. There are these feelings that some people feel, oh, I have to be strong. I can't, show any weakness. It's not a weakness.
No. It takes strength to reach out.
It's so true. Yeah. And one of the things we just recently spoke with Carl about, he was on the show when we were talking about the feelings of distress you might have been feeling after the big storm. But one of the things that you said to me was interesting is that we're seeing these images over and over again. We are literally sharing it every time we turn on the TV or go to our phones. And rightfully so, people are venting, they're putting it out on the internet. But there was something you said about being able to cut it off if you need to. If you need to cut the stream of consciousness, so to speak, off, that it's helpful for you. What do you have to say about that to the folks in this case as well?
Well, as I mentioned last week, that there's some things that we have control over, some things that we don't have control over. Obviously, whether it be the storm that we experienced last week or certainly last night's event, and many other tragic events, what we do have control over is how we take in information, as far as especially the media that we consume. So whether it be traditional network media or social media, radio, you name it, we have the ability to turn it off and perhaps use what I call a healthy distraction. In other words, it's almost like taking a little, you know how when you have a little child, you put them in a timeout?
Yeah.
You put yourself in a timeout for a bit so you can just simply get a break and give yourself an opportunity so you're not overstimulated.
Yes.
Yeah. And then are there any ways that we can lean on each other more and draw from those around you that you love?
Yeah, I think one of the things you can do really is just check in on each other. And we talk about a program, there's a program that I teach called Mental Health First Aid, and one of the things we do is we just encourage and teach people to reach out. If you see someone who you appear maybe not quite like themselves, or they may be showing certain, say, signs, symptoms that aren't typical to how they are, ask them, how are you feeling? Is there something going on? There's something you want to talk about, and just start that open-ended conversation.
And there are so many resources if you are starting to feel at a crisis point. Right. And we do have that information for you as well. That right there is the website for the Mental Health Advocates of Western New York. But there are also crisis numbers, which we have on our website. And of course, Mental Health Advocates of Western New York has on their website as well. So thank you so much, Carl, for being on to speak with us. I'm sure we'll be checking with you soon. Yeah. It's always good to check in. Yeah. So thanks for that. And we will be right back. But first, again, checking in with our folks out there in Western New York sending messages.